New research shows how some simple lifestyle changes might just reduce your risk of developing dementia by as much as 40%. Joining us to talk about the details and steps you can take today to reduce your risk in the future is Stephanie Tremblay, PhD candidate in medical physics at Concordia University. Good morning, Stephanie. Thanks for being with us.
Morning, Sue. Good morning, Andy. Thanks for having me.
Stephanie, can you break down the research a little bit? What were you looking for and hoping to achieve?
Yeah, so this is actually a very influential report that was published in The Lancet in 2020. Essentially, in this report, they talk about the fact that about 40% of dementia cases can be attributed to modifiable risk factors. So those are factors that we can act on by doing lifestyle changes, like we're talking about physical activity, nutrition, alcohol consumption, and so on. So in theory, if we act on those factors, we could prevent up to 40% of dementia, which is a largely untapped avenue so far, as we focus more on trying to find a cure and trying to find pills, right, to combat this disease.
Does it matter when we talk about, Stephanie, does it matter when we talk about the age that you start and initiate these lifestyle changes, if I do them later in life, or is this something that you will have had to do for years to benefit from?
That's a great question and a very active area of research. Of course, the earlier, the better. Some of these factors also include level of education. So, of course, if this has to be started early, right, motivating kids to pursue their education. And also, it's a great time to instill good lifestyle habits like physical activity and healthy eating habits. So I would for sure always advocate for, doing these or adopting these healthy lifestyle habits as early as possible, starting as a kid. But of course, it's never too late to take a positive turn and make changes to better your health.
Stephanie, we know the population in Canada is aging, obviously. So how does this put more of a strain on the healthcare system with rising dementia cases? Is it more than just the dollars involved in treatment, et cetera?
Yes, of course. It's going to be a lot of also human resources to take care of all the people that are likely going to get dementia, including Alzheimer's, in the next few decades. So we're expecting to reach about 1.7 million Canadians having dementia by 2050. So, of course, this is going to put a lot of strain on also the people that have to take care. So often the loved ones take a lot of the caretaking responsibilities. And then our healthcare system, which is already under a lot of pressure, will face even more pressure. And as we're seeing with also the new drugs that have been approved, that are going to require a lot of medical professional to administer, because those are injections. So it's every 2 weeks, and it requires MRIs. It requires a lot of follow-up medical visits. So I do expect that it's going to affect also the time that people will have to put in to take care of people affected.
We are speaking with Stephanie Tremblay, PhD candidate in medical physics at Concordia University. And Stephanie, looking at some of the notes in the research, I found this interesting, that we have quite a few factors, but more than anything, more than a couple of cases that are under-detected when it comes to dementia in Canada. Why are they hard to detect, or why are they under-detected in our nation?
Yes, so this is probably due to a few factors. First of all, there's the belief that these cognitive deficits, forgetting to do things, forgetting what we did in the morning, that these, changes in memory and so on are normal when we age. And to some extent, yes, like we will lose some of our sharpness, but I think this is a myth, and right, I think these changes in cognition need to be acknowledged as a problem, right, as a sign of disease, and it is more and more acknowledged, but it's still there's still a gap there. Also, for as long as we've known about Alzheimer's, there hasn't been really any efficient treatments for it. So I believe also one of the reasons why it was not detected, it was sort of the fact that we thought, well, there's no treatment for it anyway, so what's the use of diagnosing it? But now, as I said, we have some new treatments that are coming up that are promising, and also more and more evidence is accumulating on these lifestyle factors that can have a great impact also on your likelihood of developing dementia and on just maintaining brain health in aging in general.
So, Stephanie, I mean, we've talked about it. We need to be physically, mentally, socially active. Are there drugs that can help with dementia, or is that still something that, we're really working on and hopefully, coming to some sort of, a drug that will really help as we move down the line?
So there are actually, so in the last year, there's been 2 drugs that are approved now, and these are said to be disease-modifying therapies. So they've been shown to slow cognitive decline by acting on a protein in the brain so this is the hypothesis of Alzheimer, that as this protein accumulates in the brain, this protein is toxic, so it damages brain cells. So by acting on these proteins, these drugs have been shown to slow down the cognitive decline in these people, but that's over a period of 18 months, the length of the clinical trial. So it remains to be seen if those changes will continue past the trial period. But yes, so far we have those 2 drugs that are approved and one that is also showing positive results. So it will probably be approved in the next year. So yes, we do have some treatments that are showing promises, but I think in our system, we need to put more emphasis on the prevention aspect because, those drugs are not necessarily going to work for everyone. And obviously, it's better if we can just eradicate the source of those changes in the brain in the first place instead of trying to intervene later. But yes, I think the combination of the 2, those emerging treatments and the lifestyle factors will be the key in the future.
Stephanie, how do we compare as a nation when it comes to not just the research, but the resources available for those living with dementia? Do we know how Canada stacks up globally?
That's a good question. I have not looked into that specifically, but I was very surprised to realize when I was doing research on this that Canada, despite being a high-income country, still has rates of undetected dementia cases that exceed 60%. So I think we have a long way to go to be where we should be in terms of detection. And in terms of care of dementia, that's an area that I haven't looked at into that in that much detail.
Stephanie, we really appreciate your time this morning. Thanks so much for joining us.
Thanks so much for having me. Have a great day.
Thanks, you too. Stephanie Tremblay, PhD candidate, medical physics, studying at Concordia University.